Okay. Chapter 6, Muscular System. Anatomy of the muscular system. The muscular system is the system of the body that allows for movement and know what it does. It provides balance, strength, posture to the human body. What does the muscular system provide?
Balance, strength, and posture.
Through the human body. Balance, strength, and posture. The muscular system is divided into 3 groups. They always dividing stuff up. You got your cardiac muscles, your smooth muscles, which is non-strain, and your skeletal muscles. So your heart, smooth, and skeletal. Underline, there are over 600 muscles in the human body. They're all connected to your brain, spinal cord, all of that is, everything's there and connected to your nerves. But how many muscles are there? 600. Now we're going to y'all, we learned a little bit about your muscles earlier, and you'll catch on. Your muscle types. You got your skeletal muscles. And we talked about this when we talked about your brain and your spinal cord. Your skeletal muscles are your muscles that are most abundant, underline that. Come on down that next sentence. You already know this. It's controlled by the SNS, which is the somatic nervous system. And leave that there. You kind of already know that, right? Remember, the autonomic is automatic. Your somatic is your skeletal. You make that happen. You're making those happen. Okay? Then you come on down to your smooth muscles. You got your ANS, autonomic nervous system. That's automatic. Y'all kind of know this. They're just breaking it down and talking about your muscles. More muscles now. Part of your automatic nervous system, if you had to go and say that. And I always remembered autonomic first. And then it made me remember what somatic was. I know they're opposite. Underline as well that they are smooth muscles in the walls of your bladder, digestive tract, arteries, veins, ducts, internal organs. All that stuff that's happening automatically. You got muscles in there too, doing things automatically. Where we talked about it earlier, it was your nerves that went to those muscles. But now the muscles we're talking about. But it's the same system, automatic, autonomic. Cardiac is also part of your automatic nervous system, autonomic. And underline, it's actually a cross between your blood cells or muscle cells, I should say. That's why after a heart attack, we do tests every 8 hours. We are actually testing. You can tell when your heart muscles break down. It's a specific thing that it looks like inside your blood. And we will test that to make sure, is it rising or is it going down or what's the levels. And that's how we know how bad your heart was damaged, because it will be in your bloodstream. The parts that broke down will be in your bloodstream. And that's what we're always looking for. And you'll see that a lot. And y'all as phlebotomists as well, CMA, y'all probably gonna have to draw that blood every 8 hours just to make sure that person is not still in heart attack mode. Heart attack just meaning heart muscles are dying. And we can tell it through blood tests. And pain. That's when you're like this, because it hurts. You know, that's what's hurting. Musculoskeletal system. What are your basic functions? That's that last little sentence right there in that first paragraph. Basic function is support, blood cell formation. What's another name for blood cell formation? Poiesis. Hematopoiesis. Mineral homeostasis. Protection of your vital organs. Storage of your fat and minerals. And leverage. Together, your muscles and skeletal system work together to do that. make sure that you put that in your head. They're not just talking about muscles there. That's musculoskeletal system. They're working together there. So your tissues, there are 5 basic skin types, or muscle types, sorry. Your bones, your ligaments, cartilage, skeletal muscles, and tendons. And you cannot forget this. And I had to sit back and think every once in a while, still to this day, about a tendon as opposed to a ligament. And I shouldn't have to. But for some reason, I get them mixed up all the time. I really have to sit back and say, okay, oh, that's what it is. But a lot of people say that they messed up their tendon or they did whatever to their ligaments, and it's not the same. Did you sprain your foot or did you strain your foot? Those are 2 different things. We'll get there. But know the 5 basic skin types. How many skin types are they? Basic tissue types. How many are they? So your bones and your ligaments underline bone to bone. Your ligaments connect bone to bone. Ligaments connect bone to bone. When those things get messed up, you're in a world of trouble. Because you ain't got nothing else holding that together. Cartilage. Of course, we know cartilage is somewhere everywhere. In your joints, of your knees. That's where mine messed up. My cartilage broke and messed my whole knee up. You got cartilage in your ear, in your nose. There's cartilage places. But just know that it's a different kind of substance, but it is a tissue. Along with your skeletal muscles, we know all them. Those are your arm muscles, leg muscles, all your muscles. Those are your skeletals. And then your tendons. And this is where people get the mess up. Ligaments is bone to bone. It connects bone to bone. Your tendons connect muscle to bones. Underline or write that in. So you can know the difference. And you're going to have to when we talk about the diseases. Tendons, muscle to bone. All right? Get those in your head. Know what a ligament and know what a tendon is. Those are coming back to you. Each one of these basic tissues contains different combinations of connective tissues. And this is what every cell in your body starts off as being. It says fibroblast. And I always think it blasts from that. That's how I always remembered it. It's a big blast, like a big boom. Like they say we were, that's how we were born. It was a big blast and made people. I don't know. I don't believe that. But every cell starts off like that. It starts as a blast. So, underline that. It's referred to the mother cell, which produces everything else. Then know what collagen is. It's a principal protein. Just underline protein that forms non-stretchable fibers. You got a lot of collagen in your skin just to have skin, to hold your skin in. So your skin won't just, if not, that's why we get stretch marks. You got your collagen in there trying to hold it together, but then we eat so much or gain so much weight, then it stretches, but it's your collagen trying to hold that together. Elastic fibers are highly elastic, and we got to have that in your walls of the arteries. The walls of the arteries, because it has to pulsate. In order to pulsate, that means blood is rushed in, and then it rushes in again. So it's got to get bigger and littler quickly, bigger and little. So most of your arteries are very elastic. That's how we feel that pulse, and that's how you don't just blow up every time your heart beats. Or if you didn't have elastic fibers in your arteries, or else we just would be high blood pressure and blow up. But it stretches and then goes back, stretches, and that's our pulse we feel. Proteoglycans, don't focus on it, just underline matrix. Just how stuff is put together. The functions, there are 5 functions. Go ahead and put 1, 2, 3, 4, 5. And we just remember them, not terrible. Stability and posture. Movement of your body parts, we know that. Circulation. Heat production. We got to move around to keep our temperature correct as well. If you've ever checked people's vital signs at night, their temperature at night is lowers on purpose. You're not moving. You're not producing anything. You're not doing a lot of work, so your temperature lowers. And digestion. Got to have everything working so everything can work. Smooth muscles of vital organs such as your stomach help in the process of food digestion. So we've got muscles everywhere, is what they're saying, and they do all these things. 1, 2, 3, 4, 5. Come on to your muscles over here. Just know don't try to remember all them. You find what you know. And don't forget it. That's what I want you to do. Something you already know with muscles and add a little to it. We're not going to test on it. It's not going to say, what is the muscles of your lower leg. Get a little further up. And that's exactly what you'll be doing. But we're not going that far. Just know a lot of times your biceps, that's this one. And we're always thinking about biceps and your brachial artery. Just biceps brachii is what they call it, and it's because those two kind of are there together. And when y'all do go up a little to nursing or wherever y'all go, if you do, you'll notice a lot of your muscles are either half a muscle, and the word to label it is going to be half muscle and half a vein, or half muscle, half artery. But that's how they're going to label your muscles. And when you put that stuff together, you'll go a long way in labeling all that, because you will. You're gonna label all the bones in the body, and you're gonna label all the muscles in the body. And it's just because somebody says this hurt or this got torn or this, so you'll know what they're talking about, or they know what area it is. So just know that as well. Flip on over to your medical conditions. And you're going to have to know all of these. Every one of them. Atony is floppy or lacking their normal elasticity. Atony, think floppy. So I go there. Atony, floppy. And they don't have elasticity like everything else does. Atrophy is a degeneration of muscle tissue. A lot of times, people are not moving around, and they just degenerate, not used, and they get atrophy. And actually, the muscle shrinks. Have you ever seen somebody just lay in the bed a long time and their muscle shrink? How about in a cast? Ever been in a cast?
I had that little arm big one.
Yes, same kind of thing. That's what happens, and it really happens. Imagine you in a bed. Can't walk or something like that. It happens. If it happens just like that, just off a 6-week cast, imagine you doing that for a long time. That's your atrophy. Cramping. You're going to have to know the difference between a cramp and a spasm and a sprain and a strain. It will not go away. You're going to have, that's it. So, a cramp is an involuntary contraction of skeletal muscles. It's hard to distinguish between your cramp and a spasm, but we're going to get there. It's involuntary contractions of skeletal muscles. Underline that skeletal. Put that in your head real good. And usually very painful. Painful. Y'all know when you have a cramp. But that's what is happening. It's contraction of your skeletal muscles. Something that you normally would move yourself. It locks up on you. That's a contraction. Can be caused by fatigue, stress, imbalance of salts, and a lot of times it's some kind of salt, potassium. All that stuff has got to happen to make muscles move. You've got your sodium, potassium that has to cross a barrier that actually they have to work together. And if you do not have that working together, that's why potassium, people, when they have cramps, they'll eat a banana for that potassium. So their potassium and their salt that has to join together. One's a plus and one's a minus. They have to join together to make things happen. Actually, they just go across a little membrane to make things happen. The pluses and the minuses. It's all happening through your whole body. But that potassium sodium is very vital through your whole body. If you're having a cramp in your leg, imagine if, and it's caused by an imbalance of salts, imagine if that was your heart. That is a forecursor of telling you, hey, you need to eat right, get some nutrients in your body, do something, because that could just as easily not be your leg and it could be your heart that's cramping. And it's kind of the same thing. It locks on you. And so you don't want that happening. That's why, as a phlebotomist, potassium levels are so important, and you'll see that. If they've got an unusual potassium level, sometimes if you shake that phlebotomy tube too much, potassium is released. When a blood cell bursts, potassium is released. If you got too much of potassium, they're going to question that. Get you to come back, redraw that blood. So be careful with your blood. And if it's still high, then they treat it. Then they're going to give them something to get the potassium out the body. Because of them same things. The cramps is no joke. Fibrositis. Look at the word. It's itis of the fibrous connective tissues. Inflammation of connective tissues. A lot of times that's that back. Your back will ache you for whatever reasons. Fibritis. Fatigue. Y'all know what fatigue is. Myositis. Anybody remember what myo means? Myo means muscle. Anytime you see myo, it's going to be a muscle. Myocardial infarction. What's that mean? Muscles of the heart. I'll tell you. So myositis is inflammation. Y'all know itis is inflammation. Myo is inflammation of your muscle fibers. And underline that it can be caused by bacteria or parasitic. Sometimes it happens. It's just something messing with your muscle. Now here's your difference. Here's your spasm. It's a sustained involuntary muscle contraction. Underline sustained involuntary muscle contraction. A cramp is what? Voluntary. Your voluntary muscles. Skeletal muscles, I should say. And then your spasm is your involuntary. A lot of times, you've ever seen just quivering. And you don't know, it's some weird quivering feeling, especially paralysis patients and things like that. They will have spasms. But those know the difference between your spasm and your cramp. Spasticity, it is actually the readiness of your muscle fibers to contract. In other words, your muscles are ready. Some people have a lot of extra specific I can't even say it. But I call that restless legs. Like you just know you're ready. But you ain't moved or done nothing. That's what restless legs is. Best thing you can do for restless legs is to contract and release. To get those potassium and sodium stuff doing right. So you won't feel that way. Sometimes it works. Sprain is of your ligaments. So do you strain a ligament? Nope, you sprain your ligaments. But you strain your muscles. So underline sprain ligaments, strain muscles. So can you strain a ligament? No. Okay. That's the difference. Get that in your head too, because they're going to ask you sprain, strain, cramp, spasm. They're going to ask you those. Know those differences and know what makes them special, so you can point out the differences. Because they're very similar, kind of the same, but what's it talking about? What's really we talking about? Okay. All right, chapter 6. Muscles provide blank, strength, and posture to the body. Balance. Blank muscles are the most abundant in the body and they allow for movement. Skeletal. There are more than blank muscles in the human body. Smooth and blank muscles are controlled by the ANS. It's actually 9, but it's cardiac. Cardiac. Smooth and cardiac. What does ANS stand for? Autonomic. Nervous system. The musculoskeletal system is made up of how many basic tissues?
The who?
Musculoskeletal.
Yeah,
5. Atony is a condition that causes the muscles to be blank. Atony, floppy, and lacking their normal elasticity. Like the atony, floppy, elasticity, all those. That might help you put it in here. A blank is a sustained involuntary muscle contraction. Sustained and involuntary.
You said muscular contraction.
Muscular contraction, yes.
Spasm.
Spasm. Your strain is when they're messed up. Sprains are injuries to the ligament. Strain refers to the overstretch and excessive work of the
Muscles.
Get them together. You're going to see them. A blank is an involuntary contraction of skeletal muscles that's usually painful.
A cramp.
Cramp. All right. Study. Go back. When we're done, go back home. Read the chapter. When I say don't worry about those things, you can put a whole X on. Anything else that we talked about, go over that word for word, and a lot of that is in that's fill in the blanks. But stars, underlines, it's important. You'll see that again, all that kind of stuff. You will. So go back and get those in your head. All right.